Topic of discussion on Newsnight tonight, the National Hospital Insurance Fund is to increase member contributions. That is a proposal. And that will be the topic of our discussion for tonight. And the big question, do you support the implementation of the National Hospital Insurance Fund medical cover? Please send us your comments and we will sample some of your responses during the program and at the end of the program. May I now introduce my guests for the program tonight. Diana Patel, the Executive Director of Avenue Healthcare. Welcome to the program.
Thank you very much.
May I also introduce Professor Richard Muga, the Chairman of the National Hospital Insurance Fund. Welcome to Newsnight.
Thank you very much.
Now, Diana, I'm going to start off with you. The new proposals by the NHIF to increase member contributions by up to 2,000 shillings from 320. You're one of those, part of the stakeholders that are opposing this increment. Why?
Yes. Well, there are three main reasons why we oppose the NHIF plan. The first is that it's not at all clear that insurance is the way to go if you're going to take care of the poor. Insurance is costly. It's costly to administer. I think Professor Muga knows this from his experience at NHIF. The services are better given to people directly in the government hospitals and dispensaries. It's cheaper, it's more direct. The task for the Ministry of Health should be now to get drugs and reagents and equipment and so forth in the government hospitals. So improve the government hospitals and give care directly to the poor. Secondly, we're not at all convinced that NHIF is the appropriate vehicle to do this insurance if insurance is called for. The NHIF has a 44-year history of mismanagement and waste and some corruption. And even though the minister has said they can learn to walk and chew gum at the same time, it's not at all clear that they can walk at all.
Concern there being raised on the capabilities of NHIF. A lot of questions or a question there being raised about issues of corruption. And of course, there are those who have said, well, previously you have put your money into buildings, into parking lots, as opposed to putting your money in drugs. If we look back, first of all, at the rationale behind the increments, why was it done?
Yeah, let me say that before the decision was made to increase the rates, there was a lot of prior studies which have been done. One of them was to assess what our members want. And one of the strong recommendations is that they want outpatient cover. And they also said that they also want to access the care at nearest points to them. And based on this, an actual study was done to try and determine whether it is possible to do it or not. And based on the findings of the actual study, it was found that it can be done because other countries have done it and other countries are also doing it. And based on this, certain computations have been done which eventually led to what we call a pilot study, which was tried in Nairobi and also in Mumias. And based also on additional studies that the government of Kenya does, national health accounts, Kenya demographic health surveys, computations were done and we found that in order to provide outpatient cover to the members, we would have to increase the contributions. And therefore, these contributions have been considered based on what would be the income of a contributor.
Stakeholders are questioning if you are the proper channel, the appropriate vehicle to do this, though, to conduct the, given your past history of corruption.
We admit that our past history has been bad. That one we say. But you know, if your past has been bad, if you are aware, you can also emerge a strong institution. This is where we are coming from. Yes, there would have been the corruption. In those days, NHIF thought that they had surplus funds, but the reason was that the benefits package was very low. But today, as we talk, NHIF has increased its benefits package to the members from 20 to 60%, and there are no more surplus. and therefore there would be no more investment into a building.
Diana,
I'd like
yes.
to point out also that the results of the actuarial study and the results of the pilot project were not presented to the stakeholders and to the private sector. They're kept very secret. So we're having to take your word for it. And given what I know about costs of medical care and the frequency of visits of people for outpatient treatment worldwide, which is 4 to 5 visits per person per year on average, I question whether the study was even appropriately carried out.
Well, one could say that the results of the actuarial study, it was first done by Alexander Forbes, which is an international firm renowned and known to do these studies. And the results are available even on our website. Then secondly, the study on the pilot that has just been completed, which informed our rollout. Yes, some of the details are being finalized, but it will be shared. It is available. Some of the findings are secrets to the fund, because you also don't want to tell your competitors how you are going to price your cover. So, but it is available. The board has deliberated, and it will eventually be shared. But as Diana says, if she wants to know the secrets, because she also runs some form of insurance, if we were to tell her how we have arrived at the package, it would be tricky for us. But she can come in private and we will share with her. But the board of management, which is fairly representative, they have discussed this and they have found that it is possible to do it.
First of all, I don't think that we're competitors to NHIF at all. NHIF is a mandated scheme. I'm a member. I don't have a choice in this. So I pay to NHIF and I also pay to another scheme. And many of the members do this. We don't have a choice. So as far as being competitors, that question doesn't arise at all. But as members and as members of the public, I think they're entitled to look at these studies and to assess them. Now, I checked the NHIF website today, and I found no actuarial study results.
Issues of accountability.
The actual study was done actually in 2007. The results are available. You can be sure. What is not on our website is the pilot, which has just been completed, and soon the results will be made available. But the board has considered this, and that is what we have used. But also, it's good to add that for the last 20 years, the fund has not made any increase in the rebate and has continued to provide care and coverage to its members. But what we have with the current rates cannot offer outpatient care. And this is the justification for increasing the rates, so that we can have members seek care that will essentially be primary health care, which includes pregnancy checkups, includes treatment for malaria, includes treatment for children, includes simple investigations which the population requires, and will eventually cut down the cost for or the need for admissions.